Treating female hair loss the same way as male hair loss is one of the biggest medical mistakes I see. Men and women do not lose their hairs in the same way, and if the diagnosis is wrong, the treatment will fail, no matter how expensive it is. I am Dr. Samiksha Tyagi, plastic and hair transplant surgeon. I see both male and female patients every day, and one thing is very clear: hair loss behaves very differently in men and women. Today I will explain these differences clearly so that you stop comparing your hair loss with someone else's. Most people compare their hair loss like this. Many a times a lady patient comes to me and she says that my brother has hair loss in such and such way, my husband is losing hairs like this. But biologically, this comparison is wrong. Men usually lose their hairs in a visible pattern, while women usually lose their hairs in a diffuse pattern. So, their symptoms, their diagnosis and treatment is altogether different. Let me first start with a male hair loss. In males, the most common hair loss pattern is androgenic or genetic hair loss, which is due to the hormone DHT. But biologically, this comparison is wrong. Men usually lose their hairs in a visible pattern, whereas in women, the hair loss is more diffuse. In both of them, the diagnosis, the treatment is absolutely different. Let me start with a male pattern hair loss. In males, the most common hair loss cause is genetic or androgenic alopecia, which is due to the hormone sensitivity, which is DHT. DHT hormone causes effect on a hair follicle. Due to the hormones, the healthy hair follicle gradually miniaturize. That means the thicker hair follicles, they start shrinking to fine hairs, and ultimately there is a stage when men lose their hairs in particular area. And this happens mainly at the hairline area. Sometimes they see hairs are receding from the area such as crown, and ultimately these areas connect with each other to give a more extensive hair loss pattern. This process in males is usually predictable, slow and pattern based. That is why male hair loss is easier to diagnose and easier to plan treatment for. Now let's have a look at the female hair loss pattern, which is absolutely different. And the cases of female hair loss are rarely that straightforward. Women usually do not have hair loss in patches. Instead, they experience diffuse thinning. They present with widening of the parting hairline. They have reduced ponytail thickness and overall loss of volume. Many times, factors like hormone, nutrition, stress, thyroid problem, PCOS, and many more play a much bigger role in women. In males, on one hand, main cause is genetic, whereas in female, most of the time it is multifactorial. We need to treat underlying condition, and treating that underlying condition can give very good result in female, and that too without much intervention or transplant. Here is the biggest mistake. Many times women try to take treatment whatever their partners are taking. High dose of medication, wrong supplements, or they directly jump to sometimes hair transplant. This not only fails to help, but it can actually make the situation worse. Female hair loss requires more investigation, but not more aggression. Do you know, women often panic more about their hair fall, and that panic is understandable. Hairs are closely linked to their identity, their confidence and femininity. But there is a positive side as well. Women usually notice their hair loss earlier than men, and early detection means better chances of recovery. Now we know as the causes are different, and that's why the treatment differs in both of them. In men, the treatment focus on controlling the DHT, preserving donor hair and long-term planning, and giving the best possible aesthetic result. Whereas in women, the treatment focuses on finding the underlying cause, correcting their deficiencies, correcting their hormonal imbalance, and improving their follicle strength. So definitely one size does not fit all. Let me summarize all these complex things clearly. Male hair loss is usually visible and pattern, whereas female hair loss is usually hidden and diffuse. Female hair loss is usually multifactorial, whereas male hair loss is usually hormone driven. Comparing the two only creates confusion. Correct diagnosis decides success of your treatment. Hair loss is just not about your hair. It is about understanding your body. If you want a science-based, honest hair guidance, do subscribe to this channel. Your hair deserves personalized care and not the copied solution. Thank you.